Today, we are going to discuss a condition that has affected many people yet remains surrounded by misconceptions. Gout. Gout is a widespread form of arthritis, often caused by elevated uric acid levels in the blood. In this video, I will be discussing what causes gout and what to do if you have any symptoms of this condition. I am Dr. Mohammed Sharif, consultant rheumatologist at Shirley Oaks Hospital in Croydon, and I have been treating patients with gout for over 13 years. My hope is to shed light on the causes of gout and help you understand how to manage it effectively. So, what is gout? Gout is a type of inflammatory arthritis that affects between 1 to 2% of the population in UK. It results in sudden severe inflammation which causes intense pain and swelling in the joints. Although gout most commonly affects the big toe, it can also impact other joints including ankles, knees, wrists, elbows and fingers. Historically, gout was known as the disease of kings or a rich man's disease due to its association with consuming rich foods like red meat, seafood and alcohol. While diet does play a role, we now understand that the causes of gout are far more complex. Certain individuals may be predisposed to developing the condition, while others may never experience it despite similar dietary habits. So what are the symptoms of gout? So gout symptoms often begin in the big toe, but other joints can be involved. Attacks usually start at night and peak within 12 to 24 hours. They can last from a few hours to several days or even weeks. During an attack of gout, you may experience intense joint pain, red, shiny skin over the affected area, severe tenderness even with a light of touch, swelling around the joint, a sensation of warmth in the joint and joint stiffness. Why does gout occur? Gout occurs when uric acid, a waste product formed from the breakdown of certain foods, builds up in the blood, and this condition is called hyperuricemia. Uric acid is typically dissolved in the blood, filtered through the kidneys, and excreted in urine. However, if your body produces excessive uric acid or your kidneys fail to excrete it properly, hyperuricemia can develop. It's important to note that having high uric acid levels doesn't necessarily mean you will develop gout. Many people with hyperuricemia never exhibit any symptoms. Gout symptoms emerge when sharp uric acid crystals accumulate in the joints, causing sudden pain and swelling, commonly known as gout attack or flare-up. Who does gout affect? Gout is more prevalent in men than women and typically develops in middle age. Women are less likely to experience gout before menopause due to the hormone estrogen, which helps the kidneys to eliminate uric acid. Gout can sometimes affect younger people, and in these cases, the symptoms are usually severe. What are the causes of gout? Several factors can increase the risk of developing gout, including genetics, diet, certain health conditions, and medications. Risk factors for gout include family history of gout, increasing age, obesity, alcohol consumption even in moderate amounts, eating foods high in purines such as organ meats and seafood, and consuming high fructose corn syrup drinks. Health conditions and medications that increase the risk of gout. Certain conditions can predispose individuals to gout, including chronic kidney disease, hypertension, diabetes, cirrhosis and hemolytic anemia. Rare genetic disorders like Kelly-Siegmiller syndrome or Lesch-Nyhan syndrome can also cause hyperuricemia by affecting the body's ability to regulate uric acid levels. Medications that may increase the risk of gout include aspirin, diuretics, which commonly used for treating high blood pressure, niacin, which is the term for vitamin B3 supplements, and cyclosporin, which is an immunosuppressive medication. What can trigger a gout attack? Several factors can trigger a gout attack, such as injury to a joint, dehydration, certain medications, particularly low-dose aspirin and diuretics, surgery, low-level arsenic exposure, consumption of purine-rich foods and alcohol, particularly beer. When to seek medical advice? Gout symptoms can resemble other conditions, like a joint infection, which requires immediate treatment. If you experience symptoms of gout, schedule an appointment with your consultant promptly. Seek medical attention if you have gout symptoms, but no prior diagnosis. You have been diagnosed with gout and are experiencing a flare-up, or your symptoms haven't improved after a few days of treatment. So, that's a brief overview of causes of gout. If you have any more questions, feel free to leave them in the comment section below. If you would like to arrange a consultation with me or another consultant in your local area, you can call us or book an appointment at circlehealthgroup.co.uk.